I have split my presentation in three parts. As said before, we are one of the leading institutions in this European MHead hub. For the purpose of this presentation, I would like to give some very quick background elements, then to explain you a little bit about this project, this European MHead hub that is envisioned to become a sustainable actor. We are now in a project phase. And finally, the outcome that we wanted to present, that is the repository of COVID-19 apps. Regarding the background, well, we use some of these slides to say that the purpose of MHead is mainly to transform the way we deliver health service. So especially for those people that might be more reluctant to this technology, this means like changing the way things are done. I wanted also to refresh a little bit because this is like one of the backgrounds of the hub itself. I don't know if you are very familiar with this initiative. It's a joint initiative from WHO and ITU called Be Healthy, Be Mobile. And they have not worked it so much in Europe, but they have developed it in several countries, how to scale up MHead. So as you can see here in their own page, there is a mention to the hub. Now I will explain a little bit later the connection and where we come from and where we expect to go. We also like to provide like some lessons from previous experience, in this case from Africa. Sometimes not all the people now with all these contact tracing apps in Europe and in the worldwide, we have the big precedent in Ebola. So just to show that there are several things already done. For example, some years ago, these guidelines, so probably Europe can also learn from this. Just to explain a little bit, because in Spain we are like the healthcare is provided by the regions. I'm speaking to you from the south of Spain, from Andalusia. We have 8 million inhabitants. I belong to a specific agency working on quality, patient safety, and innovation, and we have several MHead programs. And we are also in the Iponaja initiative. Well, several actors, but with some ground experience in MHead. Here you have some information about our different parameters. We are a big, one of the biggest region in Spain, and we have developed many things in digitalization. For example, we have the main thing is that we have one single health information system from the late 80s. And for example, we have quick salute proofs that it's also regarding how to have all the information in a single place in the phone and so on. But I will not talk too much about this because it's not the main purpose. Regarding the European MHead hub, there are several objectives, and the main thing is that it's about sharing knowledge and fostering innovation at large scale, because MHead many times is about small initiatives or pilots or so on. So that would be like the main purpose, right? You could be wondering, where do we come from? Well, this is currently this is an Horizon 2020 project. Andalusia, along with ITU and WHO, we are the main institutions in this project, funded by the European Commission. But Andalusia, in fact, comes with a big consortium of 18 partners from different ecosystem elements and from several different countries. So for us, this is always our strong potential. You can see here some governments, some providers from different parts of Europe. Also, we have representatives from tech sector and also academia and NGO. we came together in a proposal. We were the tender winners, and well, then finally we could be able to get into this project, right? And this is a nice picture. We had a meeting in Geneva, and I invite you to visit our website, and also a promotional video was done. I guess that you will have access to the presentation, and you will have my email also. So during the project, the hub is going to produce some outcomes. Actually, some of them are already in process, different toolkits, for example, for regarding assessment frameworks, also some about diabetes, also the key aspect of integrating MHead into the systems, into the electronic records, and so on. And also one main part is to produce a service portfolio, mainly for countries, but also for other organizations, to become the hub sustainable. Because the idea is that the hub could help countries to move forward in MHead implementation at larger scale. And also, of course, things regarding ethics. I have to say at this point that this was a NCD-focused project. But then COVID-19 came. So we felt that we needed to do something, and of course also to adapt some of our products to it. But in this sense, we developed a repository that I will explain a little bit right now, the third part of my presentation. So in March, we started volunteer with this initiative. The Commission itself also thought it was a good initiative. We are aware that different institutions started to help trying to compile and to follow and to make a tracking on what different countries were creating and so on. So you can see it. It is in our website in this direction. It's in the Ants page, so it is not quite difficult to find. Initially, we create. Well, we have like a form that people can fill in, but also we have done like a proactive tracking of new apps, especially in the last months about country contact tracing apps, right? In this sense, also to mention that probably you all know, but the Commission itself put MHead in the center of the solution for COVID with this recommendation every April, and also with the first version of the toolbox, where the European MHead Hub itself was mentioned as one of the resources. And also, well, the MHead network has developed several actions. They are doing a very intense work. In mid-June, they published this progress reporting about how countries were facing the COVID with their tracing apps. So, well, this has been our basis, but we are always making follow-up on new applications and so on. Currently, we have around 80 apps gathered. Initially, we created 3 categories in the sector: the public ones that would be like the country promoted or regional, the private one, and the community-based, because sometimes it was not easy, you know, with all this emergency, it was not easy sometimes to differentiate them. But and now we have mostly public, but also we are open to the other initiatives. We also we have done a work with our designers for making this repository more user-friendly. So you can search also by purpose of the apps. We have taken the classification that is in the Commission document, well, mainly providing general information about COVID or symptoms tracking and tracing. That is the main purpose for today's presentation. Communication when the patient is homebounded, and also for the health professionals to make the follow-up with the patients at home, or even for their own self-care, because health professionals are being like the real heroes in this. And also regarding countries, I don't know if you can see it, but we have tried to give a wide coverage, and with EU countries and also with non-EU countries. So, well, this is like our retail help for this COVID situation by now. And as you know, the monitoring of the effectiveness is like one hot and key point right now. And well, we think that this repository could even be a good base for Europe for provide or to display more information about the effectiveness. But as you know, many countries are just launching their own apps, and we had a very intense summer. And finally, what you could find about each app, you can find, as said before, the sector, the purpose, the country or the region, the name of the app. And also you have direct access to the app with a short description and the link to the stores. And if there is some relevant link, you can take it. The project language is English, so we have tried to provide information in English, but sometimes when we find it was interesting, quite interesting, there are some other content in other languages. And also we have included, especially for countries, the targeted population, because sometimes some regions might be even bigger than some European countries. Well, it is a nice information. So I think this is the main information I wanted to share with you. I appreciate your time, and I'm happy to discuss with you. Thank you.